across this state. There are now risks and threats with people that breach public health orders, and the police have specific operations in each of those areas to make sure that people comply and put us in a position we can best get through this challenging time.
It's now 7 weeks in. The numbers continue to rise. They are bouncing around. But what is it going to take? What are you waiting for to pull the trigger and further impose more restrictions, like a ring of steel, like a curfew? What is it going to take?
I think what we also have to accept is the basic fact that Delta is very different to other strains we've had. So policy positions that may have worked in the past aren't going to have effect with Delta. And that is something we need to accept. We need to accept this is a different variant and you need to approach it in different ways. Can I just finish my sentence on that one? So in relation to that point, based on the health expert advice, vaccination reduces your chance of spreading, it reduces your chance of landing in hospital, and it reduces your chance of dying. That's why a targeted approach in those local government areas with our vaccine strategy is absolutely key to seeing us maintain and reduce those case numbers. Please know that had we not been in this difficult lockdown for 6 or 7 weeks, the case numbers would undoubtedly have been in their thousands and thousands every day. That is no doubt about that. But there's also no doubt that the Delta strain is different to other types of COVID we've had in Australia, different types of COVID we'd have to deal with in New South Wales. So your approach has to be different. Fortunately, we have the tool of the vaccine we didn't have before. Lucy,
Are you saying that you've had advice that a ring of steel, a curfew and further restrictions will not work because it's Delta, and therefore this is, you've been told, the health advice is there is no further we can go on restrictions?
Oh, look, if the health advice suggested to us there was further we needed to do, of course we would do that. But we also have to accept that part of the challenge we have in New South Wales is because of lack of compliance. Part of the challenge is just because Delta is very, very different to anything we've seen before. And part of the challenge is, of course, having people accept, a small handful of people accept that this is serious. Unfortunately, there are still pockets of people who think that this is not a serious illness, who don't believe that they need to follow the health orders, and that impacts everybody. But moreover than anything else, it's the way this virus spreads and the way the virus moves. And can I assure you that short of not having authorised workers do what is necessary, it is really difficult for us to get to lower case numbers without that targeted vaccine strategy.